Okay, so the first thing I'm going to do is come over here to check my chart, and her name is Jaguar Jones. The date of birth is 8/25/1963, and she is allergic to penicillin. Now I'm going to check my MAR, and what I have ordered is heparin 5,000 units subcutaneously every 12 hours, and now I'm going to perform hand hygiene. I'm going to come over here to my vials to see which one's heparin, and this one is heparin. Heparin is ordered for 10,000 units per milliliter, and the expiration date is May 5th, 2020. Now I'm going to come over here to make sure that this is the correct medication. So it says heparin 5,000 units, and this is 10,000 units per milliliter. I'm going to give it subcutaneously every 12 hours, and that will equal to 0.5 milliliters that I will administer today. So now I'm going to come over here to prepare my medication, and so I'm going to pick the correct syringe, and the syringe I'm going to pick today is the 1 milliliter tuberculin safety syringe. So now I'm going to prepare to take my medication. Come over here, I'm going to clean the top of the vial. Okay, now I'm going to open the syringe package, take the syringe out, uncap the syringe, and now I'm going to draw back 0.5 milliliters of air. And put it into my syringe and administer my 0.5 milliliters of air. And flip it. Now I'm going to get 0.5 milliliters. Okay. And now I'm going to scoop my needle, recap it. Now I'm going to come back over here to the MAR to make sure I did the correct dose, which is heparin 5,000 units subcutaneously every 12 hours, and this is heparin 10,000 units per milliliter, which would equal 0.5 milliliters. And now I'm going to go check with another nurse to make sure I got my dose correctly. Now I'm going to come back over here, and I'm going to label my syringe. And on my syringe, I'm going to put heparin, which is ordered 5,000 units subcutaneously, and I'm going to administer 0.5 milliliters at 1200, and my initials. I'm going to put this onto the syringe. Okay, now I'm going to take my syringe, my vial, and my MAR and chart with me, and now I'm going to enter the patient's room. Hello, my name is Lindsay. I'm going to set this down. Perform hand hygiene. My name is Lindsay Keating. I'm with the University of South Alabama College of Nursing. I'm here to administer your heparin today, which is prevent your blood clots. Okay. So the first thing I'm going to do is make sure you are my right patient. My patient chart. And I see that you are Jaguar Jones. Your date of birth is 8/25/1963, and you're allergic to penicillin. All right. So the first thing I'm going to do, I'm going to perform my hand hygiene again, and I'm going to, can you stand up for me? I'm going to locate where I'm going to be injecting the heparin today. So I'm going to lift your shirt, is that okay? Yep. Okay, so for subcutaneously, I would do it 2 inches to the left or right of the umbilicus, or the top of the thighs, or the back of the arm. And for IM, I'll locate, I'm going to have you lift this if that's okay. Yep. I'm going to find the deltoid process, just right about there, and I'm going to put my triangle and I administer right in between my fingers. And I'm going to have you lift your shirt on this side for me if that's okay. I'd find, the way I would find this one is I'd locate the greater trochanter. Okay, and I put my palm on the greater trochanter and find the anterior iliac crest and administer right in between my fingers, and I don't know any bruising and the muscle is present. Okay, so now I'm going to administer my medication, but the first thing I'm going to do is I'm going to make sure that I have the right patient, which I do, which is Jaguar Jones, and that I have the right medication, which is heparin 5,000 units that is ordered, and this is heparin 10,000 units per milliliter, and the expiration date is May 5th, 2020, and this is 0.5 milliliters that I'm going to administer, okay? And I'm going to do it subcutaneously every 12 hours. So now I'm going to put on my goggles, and I'm going to don my clean gloves. And now I'm going to clean my injection site. Okay, and now I'm going to administer my medication subcutaneously, which means that I'm going to pinch the skin and I'm going to inject it 90 degrees, injecting my heparin 0.5 milliliters. Okay, I'm going to put the cap up, put it in my sharps container, and now I'm going to note of any allergic reaction in the patient. If the patient is having any discomfort, and I'm going to put down, make sure they're comfortable, and I'm going to put it, document it, and that completes my medication administration checkoff.